Nan University. He's the current chairman and professor of the Department of Orthopedic Sports Medicine and the past president of APKASS, as well as the current president of the Chinese Society of Sports Medicine, right? So he's going to talk about the isometric technique, which is a key technique for ACL reconstructions. So Shiyi, are you ready?
Hello. Good evening.
Yeah, we can hear you. Thank you very much.
Okay. This is Chen from China. I'm from Huashan Hospital, Fudan University, Shanghai. This is my Department of Sports Medicine. We have special cadaver label and rescue helicopter. This is my disclosure. Let's review what is the aim of ACL reconstruction. Joint stability, yes. Cartilage protection, yes. Return to sports, yes. So ACL reconstruction is the most challenging. So many surgical procedure, variation, and technique proposed, including single bundle, double bundle, triple bundle, inside ACL reconstruction, ALL, outside stabilization, or whatever. So we cannot know what is the best solution. So the principle of the ACL reconstruction is to restore full function or early return to sports. So no complication or less failure. There is a good long-term outcome. So the ACL reconstruction is still uncertified, still have a greater failure, and by 10 years, so like autograft 8 to 10 percentage failure rate, allograft more high failure rate, and synthetic is controversial. Such as last, some people report only 3.5 and some carbon fiber, and Gore-Tex have more than 50%. So this is what we think the main problem caused the following three part. What is the perfect solution for ACL reconstruction? Uniform the procedure. So as Fred Fu said, we should treat every patient with individualized procedure. So when is patient indication, some patients have individual demand, some patients have high demand for return to sports. And the second is a graft choice, autograft and allograft, even use a synthetic ligament. In China, all surgeons use a synthetic ligament. And the third one is a tunnel position. So we classified the isometric point or non-isometric point. This is only two. We have experienced the evaluation of femoral tunnel from over top, from the double bundle or single bundle, or anatomical, or such as the ideal concept. So before we always mentioned the Bancha cord or white shield, which is called by the non-isometric technique. So you can see how to find the isometric point. So in the left isometric point, ACL reconstruction, we watch there is a little graft tunnel motion, GTM, and on the right, this is failed operation. There is this is no isometric technique. We observed that there is obviously graft tunnel motion. So where is the most isometric point. So we do the technique. We also agree with the idea conception. These including isometric, direct fiber, anatomic, and low tension. So isometric is the main conception. So there is some score to do research on the gravitational motion, sclerodia. So we classified 3 types of gravitational motion during the ACL reconstruction. So this is a non-isometric technique. You can see the gravitational motion in the bone tunnel. Oh, this is isometric. And the third one, this is nearly isometric, just only a little bit, 2 millimeters gravitational. So if we do the long bone tunnel, that is non-isometric, that will lessen the bone healing and cause a graft loose or screwed loose, even caused the graft failure or gravitational motion, graft rupture. So I think the isometric is more important. Recently, we published a paper in the OJSM, the effects of nearly isometric ACL reconstruction on gravitational motion. This is a qualitative clinical study. So we defined where is the isometric point in the femoral side. It's located in the lateral condyle region. And where is the isometric in the tibial side? It's just in the center of the ACL tibial stump. So we use the intermeasure to watch the graft motion, to measure the graft motion. And also we do the 100 cases by one doctor. So this is a non-isometric position. This is isometric position. So we calculate the relationship of the different position and the gravitational motion. So what we found, the isometric is just located with the ideal conception. So we also do the isometric technique for all type of graft. And we also do this technique using for the synthetic ligament ACL reconstruction. So all patient is satisfied, have a very good long-term result. I just show a video how to find the isometric position in femoral joint, in femoral position, and where is the tibial isometric position. So this case, we use synthetic ligament because this is a very strong athlete. He wanted to quicker return to sports and have a more strong ligament. So we use the artificial ligament. This artificial ligament have a strength more than 5,500 Newton. So we measured the gravitational outside of the joint when we bend the knee from 0 to 120. So at the same time, we do also a cohort study of near isometric technique to prospective compare the outcome of ACL with or without isometric technique. At the meantime, at least 2 years post-operation. So this is inclusion criteria and exclusion criteria. So we do the follow-up. If variation from 7 months, 6 months, 12 months, and 20 months. So this work does not finish. We will persist to 4 years at least. So we do the subjective variation and objective variation. So this is the result of knee physical examination with KT 2000. And we have 2 case failure in isometric group. So this one, this is K. They are isometric group, but they use the autograft or allograft that they failed because of the re-injury in football and basketball. And we have 5 cases failure in non-isometric group. So there is a hamstring and allograft or autograft. There is 2 synthetic. That means if we put wrong bone tunnel, the high rate will be damaged. Okay, so you can see this is isometric group. This is non-isometric group. So conclusion, at the meantime, 24 months after ACL reconstruction, the case with near isometric technique show significant superior clinical outcome and knee function recovery in compare with those with non-isometric technique. This case with non-isometric technique might be caused by recurrent knee laxity or poor recovery. So we also do the national investigation, multiple centrigation, to investigation how much the long-term failure rate and the complication rate with a synthetic ligament in 20 orthopedic sports medicine centers in China. So this is a longitudinal study. We have 1,700 cases get reviewed, and with average follow-up 7 years. The cumulative failure rate is about 4.5, and complication rate is about 4.1%. So we also investigate how many patients they can return to sports. This is a level 2 prospective longitudinal study with 10 years follow-up to compare the outcome of large ligament versus full strength autograft. So for the return to sports in half year, it's about 70% in synthetic ligament and 30% only in autograft STG. And by 1 year, there is almost 90% use ACL reconstruction with last ligament. They can go back to sports, and only 60% can only go back. So this is the second look of synthetic ligament after 10 years. You see there is no failure covered by the synovium and looks very good. So it's not the problem if we do the isometric technique. So the final conclusion, what is my solution for the ACL reconstruction? We showed find a suitable patient indication, and according to the patient demand, return to sports high demanding or low demanding. And the body size is also important. If the big body size, we prefer use synthetic ligament. And the second, the precise surgical technique, isometric, always isometric. The third, right liberation program. So the key technique, isometric terminal position, we try to find individual suitable graft use, not always the autograft or allograft. You can use the synthetic ligament. Simple surgical procedure. Don't do too much to the soft tissue or bone damage. Less normal tissue damage. Thank you. Thank you.